that's present in Zoom. And if you do have questions, you can write them in the chat. I believe we'll have time at the end to address at least some of them because we're doing pretty well on time. So thanks, everyone. So our final presenter this afternoon is Lidia Esther Muñoz Paniagua, excuse me. Just making sure we've got. Oh, yes. Lidia is an anthropology PhD student whose research focus is on the temporary visa program in the United States known as the H2 visa program. Lidia completed her undergraduate studies at the University of Texas at Arlington, and she earned a BA in music. I didn't know that. And another in anthropology. She holds an MA in cultural studies and another one in social anthropology. So she came to us very well prepared. In 2017, she received the Fray Bernardino de San Juan Prize for her research called Permanentemente Temporales, an analysis of the hiring practices of the H2 temporary work visa system in Mexico. In addition to temporary migration, she has participated in several research projects covering topics such as gender inequity in the Mexican media, labor practices, and climate change. In 2021, she joined us at UO as a PhD student in the Department of Anthropology. So please join me in welcoming Lidia.
Thank you very much, and thank you very much to all the class people for funding part of my research over this summer. I'm a little bit not technology savvy, so please forgive me if I'm not. Okay. Yeah, so the name of my research, I'm still exploring names for like my final dissertation research, so this is one of the approaches. And it refers con que tengamos vida y salud, like usually in Mexico when you say, hey, how are you? And things are not going really great, you know, and you're like, well, blah, blah, blah. Yeah, things are not like very shiny, but you say, con que tengamos vida y salud. Like until we keep our health and we are alive, we can keep moving, right? And I'm trying to address the idea that sometimes with the H2 program, we do not have like great health for the workers. So this part of my research, what am I doing? Okay. I got that, no. There we go, just click it well. So it's kind of trying to piece together a lot of things that have been going on my mind. I started doing research with H2 workers about 12 years ago, give or take. And I have like these things going on in my mind, and you know, I just kind of put there like a messy landscape of how I've been thinking about H2 research. There's a lot of complexity to the issue concerning the recruitment, concerning the community of origins, the circumstances and labor conditions when they come to the US. And as I've been working through my PhD, you know, I finally came to the decision that I had to focus on health, right? And that's kind of what I did starting on the summer is part of that process. So I want to talk to you, like the presentation, I kind of organized it. I'm gonna give you like a brief context of the H2 program for those of you that are not familiar with it. Then I will talk about what was my proposal for class. And I say I was because you will see at the end that I didn't do one single thing that I had proposed to the class. I will explain, you know, and how that's why I have like number 3, which is reimagining the research, right? Because, and then some preliminary results of that imagination process afterwards. I also want to acknowledge that I had during the summer and during the year, another research grant that was the Consumer Protection Grant. And some of the things they are like interlocked, right? Because when things did not work as I had envisioned, the Consumer Protection Grant is for to do research in Oregon. So I had envisioned more of a kind of doing a lot of survey type research, and I had envisioned the class grant to enable me to do more of like a deep ethnographic research. Again, that did not happen as I envisioned it. So let me go here. What I had wanted to propose in the class, well, actually what I proposed with the class research was to do focus groups with workers that were in Monterrey in their way to come to the US. And through that, doing like more in-depth interview, asking about their state of health and well-being. So before we move into why why I was not able to do that, I just want to give you like a brief context of the H2 visa program, which is basically a visa program that allows low-skilled workers, that's how it's called, to come into the US with a visa, a temporary visa. They are here they can be here like for 15 days up to 11 months. I mean, there's more to it, but like, let's say like that. The H2 visa is a program that was started in 1952. It's like written down in immigration law, specifically in the 1952 McCarran-Walter Act. It's important to know that at that time, there were two other temporary visa programs or temporary workers program that was going on. Do not have time to go into depth of that, but we have like a 17-year overlap with the Bracero program. And what could really be the father or mother or whatever of the H2 visa could be the programs that were hiring Caribbean workers, specifically workers from Jamaica, Barbados, and Haiti. That's kind of how really to assure the continuity of those workers coming into the US, that's where the H2 program visa was created, the H2 visa. After 1986, so the H2 has been for a long while here, the H2 visa was divided in A and B. A is for agriculture, B is for other non-skilled workers. Again, I have to use the term because that's what it's on the, I'm not very happy about low skill because they really have lots of skills, but that's what they're called. And the H2B brings people working into fishery, yard work, construction, a lot of that. There's like important differences between the A and B. We're not gonna go into those, just to know that H2A visas are uncapped. You can bring 1 million workers if you want. And last year we were reaching really like 500,000 of H2A workers coming. And the H2B has a cap that is always pushed by Congress. From those programs, in both programs, Mexico has the majority of the representation. So most of H2 workers are Mexican, but there's like a majority of workers on the H2A program. There's more like 90, what is it? Oh, I didn't put the, oh yeah, 92%. And the H2B has more diversity. It's actually the quantity of Mexican immigrants is decreasing a little bit. So why did I start thinking about the health? I won't read this, but these are two quotes from two different times. Like the one here is from to your left is from 2005, and this one is from 2023. So through the years I've been doing research, I have noticed that health is a very important aspect of the experience of workers. I just have never really focused on it because I was doing other things for research. But as I started like reviewing my field notes from other years, I realized that ever since I started doing research, I had like issues about health from workers. Let it be like respiratory diseases, people that have been like really serious pulmonary damage, people that have lost limbs, and I remember this because I remember it very vividly, like one of the first interviews and watching that person without a thumb, and I was like, do I ask him about it or not? It was very visible to me. And in fact, later when I was like, had gained a little bit more of trust, yes, in fact, I found out that this thumb was lost during work. So that's how I came to understand, like health is very important. So the second thing is, why did I propose to do this research in Monterrey, of all places? Monterrey is a very important place for the H2 program. The consulate of Monterrey is a consulate that gives more visas worldwide. And that, of course, is because the majority of the visas are for Mexicans. And the US decided that the Monterrey consulate would be the one giving these visas. After COVID, there has been like a more diverse use of consulates. So there's also people getting visas in Guadalajara, Tijuana, what's it? Matamoros, and several other consulates. But the consulate in Monterrey gives like thousands of visas a year. So this has created a local thing in which you can see workers coming into Monterrey throughout the year, and they are there only for a few days to process the visa. It is also very important because there's a place where you can observe actually how the recruitment and the hiring processes take place. And it's a place where you can also observe the differential of power between workers and every other person that is involved in the recruitment, in the processing, and in the issuing of a visa. So in fact, I had like somewhere else thought about Monterrey as like the real symbolic border. Because once you are given the visa, it means that you are gonna be able to go to the US. But if you don't get the visa in Monterrey, then you have to figure out what you're gonna be doing for the next season. So I had previously created some relationships with some of the visa processors, so that the people that are helping workers to get their visas, and they had enabled me to talk to workers, to be with them, and just the fact that there's like a lot of flow of workers coming on, I thought, well, this could be, I could do some of the research as I had done before in Monterrey while the workers are coming in, right? So I went to Monterrey I was planning on being there for 6 weeks. And I went there and I just stayed like 3 weeks and like 3 weeks and a half. I was not able to get to talk to one single worker on the record. I did talk to a lot of workers off the record, right? I was not able to complete the focus groups. I also came in a very, in a moment where they were going through extreme heat waves. So we were going to 45 or 51 Celsius, which basically means that it's impossible to do the type of research that I had done before, that's being on the street talking to workers. First of all, there's nobody there. And there's also, I always, because of safety, try to partner with some research institution there. I was partnering with CSS, and they have also told me like they had like a strict policy of not being out in the street more than an hour and a half because of that heat wave. I also found like something that's very interesting, that the people that usually or have been previously open to let me allow to workers, this time they really denied access to workers. They literally said, I do not want you to talk to my workers. And there's one problem with asking permission, that once you ask about it, then you cannot undo that, right? So that limited my time to be like, oh, I was just talking to the worker, blah, 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 because I had already asked for permission, hoping that they would be like opening the gate for me, and that really did not happen. So that's when I had to start, like, I tried for 3 weeks, and then what am I gonna do? I have the money and I have to show results. So what was I able to learn from this part is that I also learned about changes in the consulate. And the consulate is always changing how things are being done, right? Like sometimes they require the workers to be there for a week, sometimes they require them to be for 2 days, sometimes they ask them to go and be like on a personal interview appointment, sometimes they don't. So I learned about these changes and how it's affecting the general flow of recruitment. And it also helped me to understand what role would Monterrey play as I move forward to my dissertation research, right? Like, is this like a viable place to do research, or yes, no, and in what, way? I also got an invitation to go to North Carolina, and that was like a very important thing. In Monterrey, there's a union that has a presence, a US union that has presence in Monterrey, that's FLOC, that's Farm Labor Organizing Committee, and then it's based in North Carolina. They have presence, like physical office in Nuevo León, in Monterrey specifically. I have known like the people from that office before, and they are no longer there. So because they are no longer there, they invited me to see the work that they are doing. Let me back up. FLOC is still present in Monterrey, but the leadership that was there before is no longer part of FLOC. And so they are not in Monterrey anymore. So because they are not there, they invited me to go to North Carolina and to see what they were doing, which is the organization El Futuro es Nuestro. That's the name of the organization now. So I was also able to reconnect with other grassroots organizations, like desperately looking like, hey, do you have any work so that I can interview, And also, I was using this time to try to find H2 workers that were coming into Oregon to also look into that with the other consumer protection grants. And I also found out that nobody knew any workers coming into Oregon, which was like also a great disappointment. I started reframing my research. So I thought, well, I'm not going to be able to do this here in Monterey. So I sent an email to the Consumer Protection Grant, and with the funds that I have left, I convinced them to let me go to North Carolina for a week. So I paid with the remaining money that I had for those 3 other weeks that I had pending on the class research. I paid my way there, and the Consumer Protection Grant allowed me to use that money for like my living expenses and gas money when I was in North Carolina. Also very important is that although it was like very frustrating, I'm very like, it's another day, no success. I really gained like, well, what I'm doing is important. I really gained like a sense of urgency that this research needs to be done. Like there's like the fact that people were really not even allowing me to talk to workers about something that's not even dangerous to them. Like in my previous research, I have on like recruitment practices, which can be like really, like if you are charging workers for their visa, you might get into problem with the worker tells you. Right now, I'm asking them how is their health? It's nothing to do with you, right? So the fact that they were not even allowing me to talk to workers, that they did not want me to talk to them, and that I was getting like all these struggles and errors, kind of started pointing me out like this is like a very important thing that I need to continue doing. So that part of reimagining research, I did go to North Carolina. Those are workers in North Carolina. And I joined again with this for the Consumer Protection Grant. And I was able to move the research further, right? I collected interviews and I started talking to workers about their health issues. So no deep ethnographic research about tell me like from since you started coming, right? But more of like short interviews with workers and grassroots organizations. So some of the preliminary research that have been important to this. First of all, and again, this is like as I move forward to my dissertation research, it's very important to distinguish the age of the workers. The H2 program has a high replacement rate. That means that some workers are not hired every season. Some workers come from 1, 2, 3, 4, 5 seasons, and then they are kicked out of the program or they are not hired again. And there's always a new influx of young workers. So when I'm interviewing young workers that have just turned 18, and I ask them, what are your health issues? When was the last time you went to the doctor? They look at me and they say like, when my mom took me to get vaccines, right? Like they don't have like a headache, they don't have, they are not even aware, about the damage that they might be getting on the limbs or something like that. When I do interviews with workers that have been coming 10, 20, 15 seasons, then you start seeing a lot of patterns, right? You start seeing a lot of, I don't know what the name in English, sciatica, like that pain that comes into your lumbar spine. You can start seeing a lot of other issues. You also start seeing a lot of the effect on emotional health. So that's important for me to reconsider when I am moving my research forward. There's a lot of important misconceptions that are also the basis for what I am proposing to do, like it's like health education workshops. You see social security number, and that the other ones are from Guatemala and Mexico, which is Instituto Mexicano del Seguro Social, Instituto Guatemalteco del Seguro Social. Those in the lower part are numbers in Mexico that grant you some access to state-sponsored health services. So when workers come here because they are documented and they get a social security number, they assume that they have some kind of health, state-sponsored health services, which is completely not true. Like the social security number does not grant you anything of that here in the US, right? So that's one important thing. And like those are so many like other examples of what are the misconceptions about the health system. So there's also this idea, what workers' compensation will cover. People are not given explanation of what a worker compensation claim is or how to file it. they do not understand that this is something that covers the employer, not the employee. So those things are important to explain to them. There's also these issues that have coming up about gender and race. I'm particularly thinking about looking into this idea of how masculinities influence practices that I will call at this moment like self-exploitation, which is basically, why did you endure, like these conditions? Why? And I think part of it has to do with this idea of them trying to fulfill the role of a provider. I also think that there's importance of continuing doing work in Monterey and processing sites, but with a different outlook, right? I will not be able to do like in-depth interviews, but I should focus in those sites talking to processors, to like the people that are, not for them to grant me access to workers, but for them to get their own ideas about the health. And most importantly, this idea of communicability or biocommunicability, which is the idea of why workers are not giving any guidance here in the US about their health and about their access to services, right? It's because they are rendered like almost like they are not seen as people, right? They come here to work and then go back to their countries, right? And this whole idea of them being whole workers is not taken into account. So those are my preliminary findings. And other than that, I just want to say thank you. And yeah.
Thank you, Lydia. So let's start with questions in the room and then we can move to questions in Zoom. And if you have questions and you are in the Zoom space, please feel free to write them out in the chat. Thank you, Lydia. One thing that I appreciate about your presentation is, as an anthropologist, as a social anthropologist, just this discussion of when research fails, what we could call ethnographic failure. And I think for us in anthropology, we don't talk about this enough. And we have our sibling subdisciplines in anthropology, like bio and archaeology, and ethnographic failure would be total failure. But for us, and as you so eloquently describe here, the quote unquote failure becomes a rich source of insight for you. And you describe some of that insight. It's not just reframing your questions for your dissertation, but also there were other things that you talked about that I found really striking, like that extreme heat and what impact that does on recruitment and on waiting in line under the hot sun on asphalt for a necessary document, right? And like, I'm just thinking how the repercussions of that on people's bodies, on their lived experiences, on the impulse to then maybe transit illicitly and not wait for the visa. I mean, I have no idea, but there's so much insight in this, a possibility of a failure that becomes really rich with possibilities for, thinking ethnographically. So I just wanted to say I really appreciated that. I also get more conversation time with you because I'm on your committee, so that's lovely. But I think that talking about gender, masculinity, and healthcare seeking is super complex. And so I have just like just sort of a note of caution, I guess, from around this. One thing that we know cross-culturally is that the construct of masculinity is associated with less likelihood to healthcare seek. And this is across ethnicity and race and crosses a lot of boundaries. So I think that the word of caution is just to think carefully about how we think of the intersection between masculinity, people's structural vulnerability as temporary workers, and they're a trajectory of a life course when maybe they've never sought care anyway since their childhood vaccinations, which they were given by the state. Their mother took them to public school and they got that and so we're in a liberalized, neoliberalized private marketplace system that's obtuse to any one of us in this room, let alone someone on an H2 visa. So I guess my word of caution is to not sort of blame people for not seeking care, and just really think carefully about the intersection between like gender and these other forms of structural inequity that these workers face. So any thoughts you have about that, but also we'll continue talking. So you could take other questions from the room also.
Yeah, well, thank you. Yes, I think I have not struggled so much as doing research with H2 workers. since the beginning when I started doing it. Like really this summer was like, I cry literally sometimes like, this is not moving forward. So, but after, like you kind of tweak it, it did like show me like some useful things. Yes, this thing about gender masculinity, I do take it that it needs to be like furtherly like thought, right? It's just like some ideas that are coming of the information that I'm getting from the field, and one thing that I forgot, it was in my presentation, but I did not mention it, is like when workers are talking about health, they are not actually talking about health. The most important conversations about health came when they were talking about maltrato, mistreatment, right? And so like the employer does not let me get water, like having people still fighting for a water break, right? That is obviously mistreatment, but it also has an impact on health. When you have workers dying of heat stroke, I mean, they are thinking about it in maltrato, not in healthcare. But when you are talking to them and they say, we cannot tell the employer we are tired, we are sick, or we need a break, because he will tell us, I brought you here to work, and if you are not willing to work, then I will give you the place for somebody else. So they are gonna endure the situation to not lose their jobs. And then I started thinking, well, why is it so important for them to keep this job, right? So that's kind of the way of thinking. But again, I do take into consideration your comment, and I'm so happy and blessed that we will be able to have more conversations about it.
Yeah, thank you. I've heard about your research and now I finally get to hear about it from you. So thank you. I was also, I guess, along the same lines, thinking about the diversity of people you might be interviewing and who they and what their cultural profile might be. How does linguistic cultural diversity reflect in those interviews? Are you asking whether, where they're from, whether they are mestizos or pueblos originarios, if they, because those cultural differences will also impact how they think about health or not think about disease and so on. So that's, I guess that's not a question, that's a comment.
Mm-hmm.
But my question is, was I correct in understanding that there are no H2 visa workers in Oregon? Is that correct?
I said so, but I probably did not explain what. There are H2A workers in Oregon. There are about H2A, about 3,000 to 4,000. I haven't checked like the last number for last year, but I wasn't able to find them through like the people that I know, like through academics. Like nobody knew anybody that was coming on an H2A visa in Oregon. So I did ended up finding them, but I found them by driving to their housing sites, which are listed by the DOL.
Okay. Yeah, I'm just thinking that the community-based organizations that we've been working with might also be able to facilitate that outreach.
Yeah, I did actually talk to Sandra about it. They do not have an outreach yet, but the exciting thing is that, we are talking about maybe doing some outreach like in the coming years. And also it's a very interesting thing about the aspect of indigenous people, like, and diversity of, in the Form DS 2000 something, or that's a form that everybody has to fill to come with a visa. There's like the language of like, what language do you speak? And one time, this is not from this research, but from other years, it came over and over that people would say, I speak Spanish, or even if they spoke like their native language was not Spanish, the people from that are the processors will always put Spanish. So there's a lot of people that are not like, they do not even speak Spanish as their first language, and they were just like granted that Spanish thing. I do ask a little bit about their background, and my hope is that with some particular people, I will be able to do more in-depth ethnographic research. And one of the person that has that, I have the opportunity to do that, is also from a Nahua community in San Luis Potosí. So I think that would be very rich.
Let's thank Lydia and just make sure that we don't have other global questions for any of our presenters today. So are there any other like overarching comments or takeaways that anyone would like to share, including on the Zoom? I don't see any chats right now, but really appreciate all of you who've joined us remotely this afternoon. See some familiar names there. But in this physical space, does anyone have any thoughts or other reflections that you'd like to share before we end our time together? Yes, please.
Just the fact that the three presentations, sorry, thank you.
Can
No,
you, do you mind introducing
Oh,
yourself?
yes, I'm sorry.
No, it's-
I'm terrible at protocols. I'm Gabriela Perez Valls. I'm an associate professor in the Department of Linguistics. And I think that the first thing that struck me about the composition of the panel is that from different disciplines and different approaches, all three presenters are addressing questions of human rights and human development, sustainable human development. Two of them in terms of health, one of them in terms of literacy and education. And so we wouldn't see, I wouldn't see the health approaches if I were only focused on the work of Stephanie. And so I really wanted to acknowledge the fact that we get this diversity of perspectives in a panel like this. So thank you.
Yes, I really appreciate you calling attention to that. Just the way that class enables and encourages sort of transdisciplinary conversations, not just for you all, but for us too, and being in this space and hearing everybody's comments and then thinking across the presentations. Hopefully you each have found that enriching as well. So thank you for that comment. Yes, Chris, go ahead.
Thank you again for everybody. I think kind of it's humbling. Just the need is so great. The issues are so profound. But at the same time, encouraged by just so many smart scholars that are attempting to address this issue. And there's something optimistic about that, is that we have kind of a new core of really smart, engaged people that are making interventions. So I guess my encouragement would be find out how to make an intervention beyond sort of the scholarly field. How can we take this research and go out into the field and make a difference? Thank you.
Yeah. Any other thoughts maybe from any of the presenters on the other presentations, or any other thoughts? Yes, Lydia.
If there's like any policy, or has there been any like advancement from the INALI, Instituto Nacional, blah, 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 for lenguas indígenas, like specifically to, I mean, is there anything being done from like the other side to help with this gap?
So in terms of policies, there is educational policies that state that there should be materials for these communities. However, the likelihood of these materials being in the language that's specifically of the community is hard. You can say, I speak Zapotec, but what Zapotec is it? Is it Zapotec from the valley? Is it Zapotec from the Sierra Sur? So to say I speak Zapotec, or to even create any sort of material that is in a language like Zapotec, you have to consider the fact that there are different variations of this language, and not one writing system and not one variant is going to cover all the variants.
So there's not been really like a good job.
I think it's just
Like moving from the policy.
Yeah, no, I don't think that there's movement, but this movement takes time. When we consider the practices of writing, we think about, oh, in English, there was a writing system years and years ago, and it's taken us even up to this point to really still produce writing and whatnot. So when you think about these languages that are at the oral capacity and have been transmitted for so long at the oral capacity, now adding a new domain, it's something that's going to take time. And
resources.
And time and resources. Yeah. I'm hopeful that, we'll get there eventually, but we have to give it time.
Thank you so much. That's so interesting. I think for the sake of time, we'll wrap, but I also would just want to have one final shout out moment for class, for all the faculty, both in this room and on the Zoom room, that do essential service for class, for Chris, for your leadership and directorship of the center. I've been a faculty member here for over 10 years and primarily advise master's students in global studies and international studies, and also doctoral students. And the important work that class is doing, funding this kind of seed funding for graduate student projects. I think we see it today. for master's students, for pre-doctoral students, for doctoral students earlier in their career, really enabling them to sort through some of the complex issues to further hone their research interests. So I just really want to shout out what the work that CLAS is doing here. And I know that it's a lot of labor, the faculty that review the grants and all the people that are on the CLAS board. So just thank you for the community that CLAS creates. And thank you all for being here today.
Thank you, everybody. For those in the room, Klaus spent way too much on food, on catering, so please take some. Thank you.